Today I'd like to speak about what I call the organic rhinoplasty or the all-natural rhinoplasty. The patients that we see in our office frequently come to us because um, they're having trouble with wearing glasses because the bridge is a little bit low, so the glasses keep slipping off. They're taking pictures on Facebook and they find that when they smile, the tip of the nose plunges down. They feel that the tip of the nose looks too round and soft, and sometimes there's the feeling that their nostrils are too wide. So we have here a typical patient with these types of features that we'll see. You can see in her case, the bridge is a little bit low, the tip is a little bit round, the nostrils are acceptable, but a little bit on the wide side. And so these are the types of very common presentations of patients in our clinic. I'd like to discuss the anatomical reasons for the appearance of the nose and what are some of the surgical maneuvers that we use to improve the situation. Starting with the tip area, the reason that the tip is round or plunges down is that the tip cartilages are relatively soft and weak in these patients. The cartilage is called the lower lateral cartilage. It is too weak to prop up the tip. In this diagram, we see in this peach-colored color a left and right lower lateral cartilage. So this tip cartilage is what's soft. Now, in the midline, deep inside the nose, is a structure called the septum, and that structure is a important one to keep in mind because that is valuable cartilage that can be used to reinforce the lower lateral cartilage to stiffen up the tip area and give it shape. The septal cartilage deep inside the nose can be harvested while preserving the structural aspects of it, and that septal cartilage can be used to reposition and reinforce the lower lateral cartilage. So you see in this diagram, the septal cartilage has been carved into a elliptical shape or a rectangular shape, placed in between the left and right lower lateral cartilages and used to stiffen up the center of the tip of the nose. After having done this, additional septal cartilage can be used to onlay as a tip or shield graft, further strengthening of the tip, as well as shaping of the tip, a wide tip, narrow tip, round tip, sharp tip. All of those things can be accomplished with this shield graft. The next aspect of nasal surgery is to build up the bridge of the nose. And traditionally, the bridge of the nose has been built up using foreign materials such as silicone plastic or Gore-Tex. Natural tissue has been used, but the natural tissues can be difficult to obtain. The natural tissues that have been used are skull bone, pelvic bone, leg bone, and rib. As you can imagine, these donor sites are hard to access and they can be uncomfortable for the patient as well, and hence the popularity of using the silicone and Gore-Tex implants. However, there are drawbacks to using a foreign material on the nose. There is a small but persistent rate of infection, extrusion, misplacement or malplacement, migration, and sometimes the bridge just looks fake or doesn't look quite right, and it looks like an operated on nose. So there's been a search for better materials, and recently what's garnered a fair amount of attention is rib grafts for use along the bridge. Um, the drawback to using a rib is that it is a large operation. You're operating very close to the lung, and it's uncomfortable. There's some pain involved in the recovery process. What I want to uh, demonstrate is that in primary Asian rhinoplasties, that is nasal surgeries where the other cartilages have not been harvested already, most Asians don't require a rib graft in order to have a nice, all-natural bridge. If you have at least one ear cartilage that's been left intact, uh, we're able to build up a pretty good bridge for you without needing to resort to rib. In some cases, I will use rib if there's no cartilage anywhere else. I have done it on those rare patients, but in most cases, we're able to avoid having to go into your rib to get you a nice all-natural bridge. Some very smart people recently figured out how to use ear cartilage to build up the bridge area. And this is called a DCF, or diced cartilage and fascia graft for the bridge. The way that this is done is an incision is made behind your ear to obtain cartilage, and then this cartilage is diced into very fine cubes, and then it's wrapped in a skin-like material that's found just underneath your hair follicles. So this is a cylindrical shaped graft that's soft, and we're able to get 6 to 8 millimeters of height. Most augmentation heights are 1.5 to 4 millimeters maximum requirement, so 6 or 8 millimeters is plenty of material in most cases. The advantage of this diced cartilage and fascia for the bridge is that it's an all-natural material of your own cartilage, so it's not going to reject. It's diced into a fine cube, so it's not going to warp. And also, because it's a soft material, it's a soft graft, it's able to fill in irregular contours. So in summary, our organic rhinoplasty is an all-natural augmentation rhinoplasty in which the nasal tip is carved and shaped using septal cartilage, which is your own material. And then for the bridge, your own ear cartilage is used to give you a nice shape on the bridge area. And then we'll address the nostrils and narrow it if necessary. But in summary, it's an all-natural rhinoplasty with no foreign material. Here we have an example of a patient who's undergone this procedure, and she's still relatively early in her recovery course. She's about 2 months out from her procedure, but she does a very good job of demonstrating this operation. So you can see from the frontal view that she has more of a bridge between her eyes, and the tip of her nose has more definition and shape. And because the tip's a little bit more projected, there's some narrowing effect on the nostril. On the 3/4 view, you can see an improvement in the appearance and shape of her nose. And on her profile view, you can see again that the bridge and the tip area are better defined. And also her entire profile is better. I have put in a chin implant through the inside of her mouth in order to further improve her profile. Because she's 2 months out, there's still some subtle swelling which will improve over the next 6 to 12 months. And I will post up some follow-up photos in the future. This procedure I first began in 2007, and over the last uh, in 2010 I completely converted to this technique and stopped using the foreign implants uh, during the latter portions of 2010. We're doing approximately 100 of these types of rhinoplasties on an annual basis. So our experience with this type of rhinoplasty is fairly significant and um, growing rapidly. And I'm very excited to share this technique with you. Thank you.